Now, the Minister of Higher Education, Research, Science and Technology on Monday received 20 lecturers and professors from Nigeria who will be serving in key tertiary and higher education institutions across the country for a period of 2-year voluntary service. The event was held at the Nigeria High Commission in Kanifing. Hadijaju reports.
The official welcoming ceremony held at the Nigerian High Commission in Kanifing highlighted the strong collaborative ties between the two nations. The Nigerian Technical Aid Corps program provides professionals to African and Caribbean countries to help meet their manpower needs. Minister of Higher Education, Research, Science and Technology, Professor Pierre Gomez, described the initiative as a testament to the enduring bonds of solidarity and cooperation between the Gambia and Nigeria. He emphasized their shared commitment to transforming higher education in the country.
We have high expectations for this cohort of NTAC volunteers. Their deployment comes at a pivotal moment in the evolution of our education sector, and we are confident that their contributions will reflect the highest standards of professionalism, innovation, and dedication. As the African proverb reminds us, if you want to go fast, go alone. But if you want to go far, go together. Nigeria and the Gambia have chosen the path of collaboration, and together we shall go far in transforming our educational landscape.
Muhammad Usman Mensara, charged the affairs for the Nigerian High Commission in the Gambia, echoed these sentiments, stating that collaboration between the two nations is a cornerstone in their mission to foster institutional development and knowledge transfer.
The Gambia has been a beneficiary of the policy since August 2009, when an agreement was signed between our two countries. Ordinarily, when volunteers are sent to a country in need, Nigeria sends some of its best who have been well-trained to such countries. It is very important to mention that Nigeria pays the passages, resettlement, and the offshore allowances throughout their tour of duty, which is usually for the period of 2 years.
Fehintola Adebowale, a representative from the Nigerian Technical Aid Corps, noted that the bilateral cooperation dates back to a technical assistance memorandum of understanding signed in 1990. He also appealed to the host authorities to ensure the well-being of the visiting professors during their stay.
While the recipient countries of ACP are expected to provide, of course, modest and decent accommodation, transport to and from volunteers' workplace, stipends as appropriate to their working environment, a passionate appeal to the host authority is to always ensure the well-being of the volunteers during their tour of duty for a sustained worthy service to humanity.
During the event, several Gambian officials commended the governments for their commitment to the education sector. These included Dr. William Jabang, Director of Operations at the UTG, Dr. Fatu A. Barry from the Civil Service University, and Maud Lamin Faro, CEO of NACA. Speaking on behalf of the new lecturers, Professor Abubakar M. Kundiri expressed their readiness to fulfill their mission at their assigned institutions. The volunteers who were deployed at the request of the Gambian Ministry of Higher Education, Research, Science and Technology will be serving at the University of the Gambia, University of Education, Civil Service University and NACA, underscoring their roles in leadership. Technical assistance, knowledge transfer will undoubtedly elevate the quality of education and institutional governance in the country. For Star TV News, I am Hadijaju.
Over the weekend, the community of SAO and satellite villages celebrated a significant stride in public safety with the inauguration of its new model police station. As our Lamin Bar reports, the event brought together government officials, partners from the United Nations Development Program, UNDP, and local leaders to mark the completion of a project designed to bring people-centered policing to the region. Details in this report.
North Bank Regional Governor Lamin Sedi Khan hailed the new facility as a symbol of hope and security for SAO residents, underscoring its importance to the community.
Inauguration of this state-of-the-art model police station in SAO. This is indeed a moment of pride, not only for the people of SAO and the North Bank region, but also for our beloved country, the Gambia, as we continue to consolidate peace, security, and community development. Please allow me to express my deepest appreciation to the government of the Gambia under the visionary leadership of His Excellency Adam Barrow.
The Inspector General of Police, Sidi Mukhtar Toure, outlined that the station's journey from a concept to a fully realized building was a challenging one. He noted that its completion was a testament to the strong collaborative spirit among all involved parties.
We are finally inaugurating SAO Model Police Station. It was a long and exhausting voyage, but you arrived to safe shores. SAO Model Police Station project is the product of collective efforts and a shared vision to make security accessible to all Gambians. SAO community members, Gambia Police Force leadership, and the United Nations Development Team draw the plans and work together to realize this model police station. It began with a vision to create a space where police officers and community members could work together to combat crime in SAO and, of course, in the neighboring villages.
UNDP Regional Director and UN Assistant Secretary General, Ms. Ahuna Izie Konwa, highlighted the station's specific focus on combating gender-based violence and fostering a secure environment where every individual's dignity is respected.
The lives of people, one that provides the kind of security that people need to be able to prosper, both politically, socially, and economically. And one of the things that we walked away with is that justice and public trust must be at the heart of any model of governance that is developed for the future of this region. Justice, public trust, and who better to prepare as an institution to deliver justice but the police. And
representing the President, Interior Minister Abdoulaye Sanyang pointed out that the security sector reforms have been a top government's priority since 2017. He emphasized the crucial link between security and economic growth, stating that security attracts investment and reaffirmed the government's dedication to ensuring the safety of its citizens.
Our communities must be saved. Our people deserve the best security service delivery, irrespective of their location. The model police station we are about to commission is the result of joint financing venture between the United Nations Development Programme, UNDP, and the Gambia government through the Gambia Police Force. Notwithstanding, I must acknowledge that the UNDP contributed the greater part of the fund, like said by the Inspector General of Police. The model police station symbolizes a commitment to improving law enforcement services, promoting transparency, and enhancing community trust.
The SAO Model Police Station is the 71st such facility launch as part of Gambia's ongoing security sector reform. This initiative reflects a broader commitment to enhancing accountability, professionalism, and human rights within the nation's security forces. Lamin Ba, Star TV News.
The Network Against Gender-Based Violence and its partners held a day-long stakeholder meeting on Monday to consult on the barriers faced by persons with disabilities in accessing gender-based violence services in the Gambia. The event aimed to strengthen collaboration among stakeholders and persons with and develop actionable solutions to improve accessibility for persons with disabilities. More in this report. Persons with disabilities, particularly women and girls, experience disproportionately high rates of gender-based violence due to a combination of negative social attitudes, discriminatory practices, and significant barriers in accessing support services. This meeting, organized by the Network Against Gender-Based Violence in partnership with UNFPA and the Gambia Federation of the Disabled, brought together stakeholders such as persons with disabilities across all regions, advocates and service providers to explore inclusive solutions and ensure that gender-based violence services are accessible to all. Mr. Faluso, the National Coordinator of the Network Against Gender-Based Violence, underscored the significance of the event, highlighting the pervasive impact of gender-based violence on households across the country. He stressed the need of raising awareness about gender-based violence among all individuals, especially those living with disabilities, to foster a safer and more inclusive society.
Today's gathering is important because we are here to discuss very important and critical issues which relates to gender-based violence. And as we all know, gender-based violence affects each and every one of us. I always say that each and every one of us is a potential victim or a potential perpetrator of gender-based violence, especially in the Gambian context. And this is why it is very, very important for each and every Gambian to know and learn about gender-based violence, especially persons with disabilities. We all know that if we are 20% vulnerable to violence and abuse, then persons with disabilities would be 75% vulnerable.
According to the World Health Organization, approximately 1.3 billion people live with a disability, with about 4 in 5 residing in developing countries where over 80% live in extreme poverty. The data revealed that 18% of the female population had a disability compared to 14.2% of males. Article 6 of the Convention on the Rights of Persons with Disabilities acknowledged that women and girls with disabilities face multiple forms of discrimination leading to exclusion, isolation, and a denial of dignity and autonomy. Women and girls with disabilities, particularly those with psychosocial, hearing, and intellectual disabilities, are at heightened risks of sexual violence and other forms of gender-based violence due to societal attitudes that view them as easy victims. Article 16 of the Convention calls for measures to protect persons with disabilities from exploitation, violence, and abuse, including gender-based violence.
Because this consultation would give us the opportunity to discuss with different persons with disabilities from different regions of this country. And this will help us to map out what are the critical needs and the critical issues and challenges that are affecting them, especially when it comes to gender-based violence, and will help us therefore arrive or derive or formulate strategies that will help us to solve or address those needs, challenges, or issues that is affecting them as far as gender-based violence is concerned.
The consultation aimed to identify systematic barriers preventing persons with disabilities from accessing gender-based violence services, develop actionable recommendations for improving accessibility, and strengthen collaboration among stakeholders. Mr. Sow urged participants to voice their daily challenges as individuals living with disabilities to foster solutions for gender-based violence, protection, and promote inclusivity.
It is very important for each and every one of you today to participate effectively, to voice out what is affecting you, to voice out what you think we can do together to ensure that each and every one of us, especially persons with disabilities, are protected from gender-based violence. We must ensure that there is inclusivity. We must recognize the fact that persons with disabilities are met with various challenges that promotes gender-based violence against them. For instance, we all know that access to information and education is limited to persons with disabilities in our environment.
Mr. Mohamed Krubali, chairperson of the Gambia Federation for Disabled, acknowledged the timeliness of the meeting, describing it as a historic moment for the Federation in addressing gender-based violence-related issues and improving access to information for its members. He reiterated the numerous challenges faced by persons with disabilities on a daily basis.
Persons with disabilities inevitably are victims and face barriers every day, especially in terms of certain features of gender-based violence known as physical, emotional, psychological, financial, and sexual violence. And once persons with disabilities are victims of this, they continue to suffer because some of them don't have access to services in order to cure these anomalies. Some of them don't even know where to report to, when to report, how to report, and who to report to. So therefore, I must admit with my fellow persons with disabilities and everybody that the decision taken by UNFPA in collaboration with NGBV to engage and consult persons with disabilities and inform us with some of this information and knowledge is indeed a very, very significant one.
Research indicates that women and girls with disabilities are at higher risk of physical, sexual, and emotional violence compared to their non-disabled peers. They often encounter significant barriers when reporting gender-based violence, including inaccessible communication, a lack of accessible services, and fear of stigma or disbelief. Many gender-based violence prevention and response services are not designed to be inclusive, further exacerbating their vulnerability. Participants at the event expressed gratitude to the Network Against Gender-Based Violence and its partners for recognizing their challenges and working towards solutions through this vital engagement. Mariam Adem, reporting for Star TV News. Now, in a recent address, Dr. Ahmadulamin Samate, the Minister of Health, highlighted the collaborative efforts between the government and citizens in enhancing the nation's health sector. He underscored the vital importance of a healthy population as a cornerstone for national development. Our Sane has the details.
Speaking at a recent handover ceremony of motorcycles to his ministry by Riders for Health, Dr. Ahmadulamin Samate stated that the government's dedication to health system strengthening is a core component of its national development policy. He noted that President Adama Barrow's vision is evident to every aspect of the ministry's work, reiterating the government's commitment to prioritizing the health of the population.
The president tells us that there cannot be any meaningful development without having a healthy population. We cannot construct roads. We cannot build bridges. We cannot do agriculture if the people who are going to work on the farms are not healthy. So health takes precedence over every aspect of our livelihoods. And to ensure that, with the help of the Almighty Allah, we need a robust health sector, where we have good health infrastructure, where we have functional equipment, where we have skilled labor, but importantly, a very robust, responsive referral system. And we cannot have a referral system without vehicles. That is why Riders for Health and Ministry of Health partnership is so crucial.
The Health Minister, Dr. Samate, underscored the importance of a robust health sector which requires quality infrastructure, functional equipment, skilled personnel, and responsive referral systems. The presence of the hospitals is not enough without competent personnel and operational ambulances, he said, proudly announcing that the government has procured over 170 ambulances since coming into power to enhance emergency medical services. In a significant new development, Dr. Samate announced that the Ministry of Health is set to launch a new primary health care revitalization and expansion program. This initiative aims to deploy health workers directly into communities and conduct door-to-door assessments for hypertension and other health concerns.
We are delighted. I must say we are very, very delighted. Very soon, inshallah, we'll be carrying out what we call the Primary Healthcare Revitalization and Expansion Program. Now, it's only about half of the villages in this country that are primary healthcare key villages. We want this to become 100%. We want every village and town in this country to have the community health workers who will be going door to door to check the blood pressure, the blood sugar of the people in our communities. I think we are marching towards a phenomenal success in health system strengthening here. Can you imagine a village that never had a health worker having a village health worker who is trained, a community birth companion who is trained, supervised by a community health worker or supervised by a community health nurse?
The minister explained that the program will also include urban primary care services, ensuring that all citizens, regardless of their location, can access necessary medical attention. He expressed his optimism that this initiative will be a transformative step for the health sector, ultimately leading to improved health outcomes for all Gambians. For Star TV News, I am Awasane.
Now moving on, the Gambia Police Force confirmed on Sunday that 2 tragic accidents in Fonye and Bafloto, located in the West Coast region, resulted in the deaths of 2 children, a 12-year-old and another whose age remains unknown. More in this report. According to the Gambia Police Force Public Relations, the Kalaji Police responded to a fatal road traffic accident between Bondali and Joreng involving a commercial vehicle and a private car with a Senegalese number plate. Reports indicate that both vehicles were traveling from Bondali towards Soma when the commercial vehicle suffered a rare tire burst. As the private vehicle attempted to overtake, the 2 collided, leading to a devastating crash. Tragically, Sidi Jame, a 12-year-old, lost his life in this incident. Both drivers and several passengers were rushed to Buyam General Hospital for urgent medical attention. The drivers, Lamin Toure, operating the Sprinter, and 26-year-old Mohamed Abdullah Nyang from Senegal, along with the following 4 individuals: Aida Sise, 35, Ume Kari, 18-year-old Senegalese, Abdullah Minte, 36, and Yassanu Bajinka, 46, sustained injuries and couldn't receiving treatment. Additionally, 2 other victims, Tunko Saidikan and Mohamed Minte, whose ages were unknown, have been referred to the Demban Clinic for further treatment. Meanwhile, the Birkama police also responded to another fatal road accident in Bafloto village around 8 p.m. on Sunday, August 3, 2025. This incident involved a motor vehicle striking 2 pedestrians, a woman and a child. According to the police, both victims were quickly transported to the Birkama hospital, where the child was pronounced dead and the woman is receiving treatment for a fracture. Authorities are currently investigating the circumstances surrounding both incidents. The police have urged all motorists to exercise caution, comply with traffic regulation, and ensure their vehicles are roadworthy at all times. Maria Madem, reporting for Star TV News.